the way the topics are arranged, or the way the topics are, the sequence of the topic is given, we don't understand it, because they start with the scalp, then the face, and they suddenly talk about the triangles of the neck. So it is not easy to understand that a topic like a triangles of neck without knowing about the nerves, vessels, and the fascia. So my approach to the head, neck, and face will be completely different. So have faith, just stay with me, stick with me, and I'll make sure that anatomy will be one of the strongest subject for you when you will go for your MDS exam here. So I'll just tell you first about a little approach, that how we're going to basically go to the subject here, and then I'll elaborate it a little more. So guys, basically, head, neck, and face. Now, ideally, I should have started with the embryology, but I'm not going to do that, because to understand the embryology of the head, neck, and face, I need to know a little about the gross anatomy also. So you must have seen, if you got the schedule for the coming days also, that I have kept the embryology in between, after the cranial nerves, and there is a reason for that. So I will be discussing today, I'll be investing the entire time for the cranial nerves. And mark my words, your 50% question of anatomy, and when I say 50%, I mean it. Your 50% questions of the anatomy for MDS exam will be solved only from the cranial nerves only. Because there is so much we will cover up in the cranial nerve, guys. We will cover up all the glands, we'll cover up all the muscles of the head, neck, and face. So there is like a lot of things which will be covered in the cranial nerves, and that's why this is the most important day, that first day, for the anatomy part here, and it is very informative also. So I'll be giving a lot of information, but I will try my best so that I can give you this information sequentially and you will understand it. Once you understand the cranial nerves, we will be in the position to discuss about the embryology, because embryology of the head, neck, and face, it requires little knowledge of the cranial nerves, guys. Then our approach will be mainly toward the blood vessels, whether it is a deep cervical fascia or whatever. So we'll go to the blood vessels. And when we have the cranial nerves, blood vessels, along with blood vessels, the deep cervical fascia, DCF, deep cervical fascia, we will use this entire knowledge to understand a topic which no one likes in first year, and that is the triangles of the neck. So we'll discuss the triangles of the neck after discussing about the cranial nerves and about the blood vessels and the fascia. And when I'll discuss the triangles of the neck with you, you will say, "Yaar, ye to bada easy topic hai. It's a very simple topic only. It's just that I need to know the cranial nerves and blood vessels first. Triangles becomes easy automatically." Okay. After that, then I will take you to the journey to the glands. We'll discuss all these major glands. Basic anatomy is about the parotid gland, thyroid gland, lacrimal, submandibular, sublingual. And finally, we will talk about the pharynx and larynx. The pharynx and larynx, we'll keep it for the last year. So this is the approach that I will take in the head, neck, and face. And once I will done with this topic, and you will start solving the questions of previous year questions, whether it is AIMS, INICT, whatever question you will try, you will understand that why this sequence is so important, and how this sequence made these topics understandable to you, right? So guys, with that note, without a further ado, let me just start with the topic itself. I would really want you people to please give me your true feedback, that how exactly the class went, and are you able to understand something, and the time you invested with me, was it worth or not? So guys, one last thing before we start, I humbly request each and every one of you, please make your own notes. Do not rely on like snapshot which you can take from these videos here. Until and unless you don't write down, until unless you will not draw anatomy, you will never remember it here. So if you really want these sessions to be fruitful, please write it down with me. It doesn't matter how your handwriting is, how your diagrams is, how your drawing skill is. Nobody's testing you for that here. But please do write down the notes with me, draw diagrams with me, and you yourself will realize that how easy it will become for you to revise from your own notes itself. Okay, so guys, let's go. So in the cranial nerves, see, as we all know that we have 1, 2, 3, 4, 5, 6, 10, 11, and 12. So these are the 12 pair of cranial nerves we have, right? Everyone knows the 12 pair of cranial nerves we got. Now, what about this 12 pair of cranial nerve, guys? See, the thing is, in the 12 pair of cranial nerve, The nerves that I'm going to discuss, I'm not going to discuss with you right now. I'll tell you why, because there is a later part where we'll cover them up here. That is the first and the second nerve. Well, the reason is first nerve is olfactory nerve. It is for the olfaction. So it's a very small nerve. There is nothing much to discuss in that. And second nerve is optic nerve. To understand the optic nerve, I need to tell you a little about the neuroanatomy also. So it is not the right time in the head and neck to discuss the optic nerve. So I'll keep it on hold. And another nerve which I will keep on hold for now is the eighth nerve. Eighth nerve is vestibulocochlear nerve. Vestibulocochlear nerve basically auditory pathway. And again, auditory pathway is something which we will going to discuss separately in that I'll combine with the neuroanatomy part here. So today, as of now, today's session, we'll be covering up remaining all the nerves here. The 3rd, 4th, 5th, 6th, 7th, 9th, 10th, 11th and 12th. So all the other nerves will be covered today itself here. Right? Now, as you know, the 3rd nerve, oculomotor nerve, 4th nerve and 6th nerve. These nerves, 3 and 4 and the 6th nerve. Now, these nerves are the one which are supplying the extraocular muscles. They're supplying the extraocular muscles. I'm pretty sure everyone knows about the extraocular muscles, the muscles which are basically the muscles basically which are for the movement of the eyeball. So first let's talk about the nerves which are supplying the muscles of the eyeball, and we also need to understand that what kind of questions can be asked from it. See, at your level, you don't expect a simple question like superior oblique is supplied by which nerve, superior rectus is supplied by which nerve. No. You have to look into some decent kind of questions, and especially for the Central Institute. So there we go. Let's start with the 3rd nerve in that case. So let's start with the oculomotor nerve. Now, please understand one thing, that whether it is oculomotor nerve, trochlear nerve or abducent nerve, because these nerves are supplying the extraocular muscles, so there is something common about their course, their relations and the way they reach the eyeball here. Now, obviously, these nerves will start from the brainstem. And I'm pretty sure everyone knows that brainstem is present in the posterior cranial fossa. So the nerve will start from the posterior cranial fossa. Then these nerves will move toward the middle cranial fossa. And what is there in the middle cranial fossa? There is cavernous sinus. I hope you know about the cavernous sinus. It's a venous sinus, the dural venous sinus, which is present in the middle cranial fossa. So these nerves will have some relation to the cavernous sinus. And then these nerves will enter into the orbit. And guys, how exactly they will enter into the orbit? They will go into the orbit through the superior orbital fissure. I'm sure you know about the superior orbital, inferior orbital fissure. So they will go through superior orbital fissure. So these are some landmarks. These are some common landmarks that you will see for all these nerves. So let's say, if this here is a brainstem. Now, I'm going to keep it very simple here, guys. I know that what are the kind of questions which are being asked here. We will not waste our time on something which is not worth understanding. Neither it is asked in the exam here. So let's keep it that way. So let's keep it very schematic here. Imagine if this here is the midbrain. If let's say that's a midbrain part of the brainstem, there are 3 parts of brainstem: midbrain, pons and medulla oblongata. That is midbrain. Let's say this here is the cavernous sinus. So in the middle cranial fossa, there is cavernous sinus. We have this cavernous sinus situated in the middle cranial fossa. Let me just highlight that for you. That is cavernous sinus. I hope you're writing and drawing with me. Then we have a fissure called as a superior orbital fissure, guys. This is a superior orbital fissure. This is a fissure which will allow the nerve to enter into the orbit. So I'm writing SOF, superior orbital fissure. SOF, superior orbital fissure. And finally, we have this eyeball where the muscles need to be supplied. Now, what are the muscles? I hope you all know that mnemonic for the extraocular muscle, that all the muscles are supplied by the 3rd nerve except SO4 and LR6. Except superior oblique and lateral rectus. So rest all the muscles are supplied by that here. So we have the muscle here that is called as a superior rectus. This is superior rectus. Then we got a muscle which is present above called as a levator palpebrae superioris. That is LPS, levator palpebrae superioris. We have this muscle called as a medial rectus, guys. MR, that is medial rectus. Then one muscle below that is the inferior rectus, IR, and there is a muscle which is called as the inferior oblique. Inferior oblique. I'm pretty sure you are all aware of this terminology here. Levator palpebrae superioris, the muscle which is responsible for the elevation of eyelid. Then we have superior rectus, medial rectus, inferior rectus, and inferior oblique. So I did not draw lateral rectus and superior oblique in this because they are not supplied by the third nerve. So let's only focus on the muscle supplied by the third nerve. Now look guys, how exactly third nerve will come out and supply these muscles? That's the anatomy we need to understand here. Now imagine करते हैं कि this is a half of the midbrain guys. Let's say if I divide the midbrain in two half. So we have a nucleus present on the right side and nucleus present on the left side here. Now this nucleus present is called as a third nucleus or oculomotor nucleus. This is also oculomotor nucleus here. But apart from that, there is another nucleus present, and that is called as a Edinger-Westphal nucleus, EW. I'm showing you the red color here, guys. Let's say this nucleus here is called as Edinger-Westphal. Edinger or Edinger, whatever you call it. Edinger-Westphal. That is called as a Edinger or Edinger-Westphal nucleus. From now onwards, in short, we'll call it EW. Edinger-Westphal nucleus or EW nucleus. Now we'll understand that what is the function of this Edinger-Westphal nucleus. So for 1 minute, let's forget about this Edinger-Westphal nucleus and let's focus on this third nerve. Now guys, what happens is the first thing you will see is the third nerve will come out of the midbrain, and then you will see third nerve is running in the lateral wall of cavernous sinus. So that's one question here. That what is the relation of the third nerve with the cavernous sinus? So it is running in the lateral wall. वो अंदर नहीं है cavernous sinus के, it is on the lateral wall. It is on the lateral wall of cavernous sinus. Okay. After that, once the nerve runs on the lateral wall of cavernous sinus, before it goes into the fissure here, understand this. Before it enters into the superior orbital fissure, nerve दो part में divide होगा. One we have a upper division and we have a lower division. So there is a upper division and lower division. Upper division will go and supply the upper two muscle. It will supply the LPS and SR. Whereas the lower division will go and supply the remaining three muscle, that is medial rectus, inferior rectus, and inferior oblique. So guys, I'm writing UD and LD. This is UD is upper division and LD is lower division. So this is how third nerve is coming out and supplying the extraocular muscles. As you can see, it is coming from the third nucleus. The nucleus present where? The nucleus present in the midbrain. So remember that also could be a question here. Third nucleus is present where? In the midbrain. Edinger-Westphal is also present in the midbrain. But right now, let's focus on the third nucleus. The nerve coming out of the third nucleus, it runs in the lateral wall of cavernous sinus. We will discuss cavernous sinus in detail in the later part. And then the nerve divides into upper and the lower division. Upper division supplies upper two muscle, as you can see. By ऊपर वाली दो muscle upper division से ही होंगी. So upper division supplies the LPS and SR, and the lower division supplies the remaining three muscles there. Now the question is, chalo, fine. Third nerve supplied all these muscles, makes sense here. What about Edinger-Westphal? Why do we have Edinger-Westphal nucleus? You know, Edinger-Westphal is basically a parasympathetic nucleus. And the function of a parasympathetic nucleus is to supply the smooth muscles or glands. Could be both, could be one of them. Either smooth muscle or gland, like usually that's the way. So what you will see, that fibers of Edinger-Westphal, what they will do, Edinger-Westphal fibers will also run in the third nerve only. They're running inside the third nerve. I'm drawing it separately. They're running in the third nerve. And then they run with the lower division. And finally, they will separate themselves. And why they separate themselves? Because now they are going to relay in a ganglion which is present in the orbit. Now, do you know what is a ganglion present in the orbit, guys? The ganglion which is present in the orbit is called as ciliary ganglion. I'll discuss about all these ganglions more in the later part. So that ganglion is called as a ciliary ganglion. So there is a ganglion present in the orbit called a ciliary ganglion. So the nerve will relay in the ciliary ganglion. So when the nerve relays into the ciliary ganglion, some short ciliary nerves will come out from it here. Multiple nerves, छोटी-छोटी nerves निकल के आएंगी. Some short ciliary nerves will come out of it, and those nerves will supply the smooth muscles in the eyeball. And the smooth muscles in the eyeball I'm talking about are sphincter pupillae. That is sphincter pupillae and ciliaris muscle. याद रखिएगा, not dilator pupillae guys, sphincter pupillae and ciliaris. Sphincter pupillae and ciliaris. Now this is what Edinger-Westphal is doing. So Edinger-Westphal fibers, basically the Edinger-Westphal fibers are running with the third nerve, and they ultimately relate to what ganglion? Ciliary ganglion. Of a ciliary ganglion, say we have multiple small nerve roots coming out, which are called as a short ciliary nerve, supplying the sphincter pupillae muscle and ciliaris muscle as well. So that's the total story of the third nerve, guys. This is how exactly third nerve is coming out and supplying the extraocular muscle also, and third nerve is also helping to supply the sphincter pupillae and ciliaris. बस ये ध्यान रखना है कि sphincter pupillae and ciliaris, though we can say they are supplied by third nerve, but their actual nucleus is what? Edinger-Westphal nucleus. Their nucleus is Edinger-Westphal nucleus. Okay. Now, a question आता है कि what will happen? See, when you get the questions on the cranial nerves, it's very important to understand that what will happen when the cranial nerve get injured. If there is an injury of the third nerve, if you have a patient with a third nerve injury, what will be the feature? What patient की features क्या क्या होंगे? That is what we need to understand here. So let's talk about the third nerve palsy. Now, third nerve palsy, guys. I hope that you already note down the things. See, just because we are already live in the Telegram group and also on the YouTube here right now, so guys, make sure that if you find anything, if you find the speed is a little more, or you want more time to write down, you can let me know. So just feel free. Just don't be hesitant to tell me that. If you want any modification in the speed or anything, I can do it very easily, because this is our first class and we need to be on the same page only. So third nerve palsy, guys. Now what happens in third nerve palsy? Let's take the important muscle supplied by third nerve and you'll get the answer. Like, one of the important muscles supplied by third nerve is LPS. Agreed? Levator palpebrae superioris. So guys, if your LPS is injured, this sign is for the injury only. If LPS is injured, if there is a LPS injury, then what will happen? There will be ptosis. आपकी eyelid जो है नीचे droop कर जाएगी. So there is a drooping of the eyelid. The eyelid will a little droop. You must have seen Salman Khan is also having a little drooping of the eyelid here. So that is called as ipsilateral, same side, ipsilateral ptosis. Drooping of the eyelid on the same side. That's one problem. Another problem, medial rectus muscle. Medial rectus muscle is also supplied by what? Now, medial rectus muscle is supplied by third nerve only. We just saw that. Abhi medial rectus is not working, but lateral rectus is working, because lateral rectus is supplied by sixth nerve. वो तो काम कर रहा है. Sixth nerve is working. So what will happen? Your eyeball will not stay in the midline. Eyeball will go toward the lateral side. Medial rectus and lateral rectus दोनों balance कर रहे थे. They were counterbalancing the eyeball, and the eyeball was in the center here. If your medial rectus will not work, your lateral rectus will pull the eyeball and the eyeball will go laterally, outside. And that is called as the ipsilateral divergent squint. That will be ipsilateral divergent squint. The patient will be like looking on, जिस eye के अंदर divergent squint होगा, the patient will be looking outside here. That is divergent squint will be there in that case. Okay. Also to be noticed, superior rectus and inferior oblique muscles are also not working. I'm only taking those muscles जिनकी वजह से आपको कोई major feature दिखाई देगा. So just focus on that, guys. So superior rectus and inferior oblique. And if you don't know, let me tell you that the common function of superior rectus and inferior oblique is both these muscles, they help in the elevation of the eyeball. Imagine karo, there are two muscles which will help to elevate the eyeball, and both the muscles are gone. Both the muscles are not working. So eyeball will turn downward. So in this third nerve injury, because of superior rectus and inferior oblique injury, the eyeball will turn downward. It will rotate downward here. So there is a ipsilateral. Ipsilateral, that means on the same side. Ipsilateral downward rotated eye. Ipsilateral downward rotated eye will be there. Ipsilateral downward rotated eye will be there here. So before I tell you anything else about the feature, now if you look at all the three features together, look at how this eye will look like. Now imagine, let me just draw this for you. Let us say this is a normal eyeball. So this is a normal, beautiful eyeball there. No problem with that. Everything seems to be normal. Eyeball in the center and everything is fine, right? That's normal. The one which is having a third nerve palsy, see how it will look like. First of all, there will be ptosis. तो आपकी upper जो eyelid है वो ऐसे नहीं दिखेगी ऊपर. आपकी upper eyelid थोड़ी सी नीचे की तरफ होगी. So first thing that you'll notice is a ptosis. Your upper eyelid will be like this. Agreed? Second thing, we said eyeball will be outside. That is divergent squint, and also downward also. So down and out eyeball, something like this. The eyeball is down and out. Look at that. That's how the eye will look like. Your eyeball, there is a ptosis, there is eyeball is outside and eyeball is down also. And this tells you about that this is a case of the third nerve palsy. So when you see a patient जिसको upper eyelid थोड़ा drooping हो रहा हो, eyeball is more outside and eyeball is rotated downward, it is a case of which nerve palsy? Third nerve paralysis is there. It's a case of third nerve palsy. What else is gone, guys? इसके अलावा और क्या problem है? Sphincter pupillae and ciliaris muscle is also not working. So if you look at that way, the sphincter pupillae, the muscle sphincter pupillae and ciliaris are also not working. They are also supplied by third nerve. Now imagine if the sphincter pupillae is not working, so what will happen? Then obviously dilator pupillae will take over. Sphincter pupillae and dilator pupillae are opposite to each other here. Sphincter pupillae काम नहीं कर रहा है, but dilator pupillae is working, and that's why your pupil will be dilated. So you have a ipsilateral dilated pupil also. Ipsilateral dilated pupil, and the patient will not respond to the light reflex, guys. The moment you put a light in the eye, the patient will not show any constriction in that pupil. So there is a ipsilateral dilated pupil, and also you can say there is a loss of what reflex? Pupillary light reflex, or simply you can say loss of reflex. Light reflex will be there. Ciliaris muscle is known for what? Ciliaris muscle is known for accommodation. So if a person is having a ciliaris muscle not working, उनको accommodation नहीं हो पाएगा. Like right now, let's say if I'm looking at my mic and suddenly I have to look at the camera far away, so I will not able to adjust my eyeball to see the far or to see the near here. That adjustment will not be possible here. So that is because of the ciliaris muscle not working. So there is a ipsilateral loss of accommodation. Important thing is, guys, everything is on the same side only. Ipsilateral, everything is on the same side here. So that's the feature of the third nerve palsy. The patient with the third nerve palsy will come to you with all these features here. There will be ipsilateral ptosis, there will be divergent squint, there will be downward rotated eyeball, usko loss of light reflex bhi hoga, loss of accommodation reflex bhi hoga, and dilated pupil bhi hongi. So that will tell you that it is which nerve palsy? It is a third nerve palsy. Now, anatomy mein na, one thing, I'm pretty sure you know that, but it's still my responsibility to tell you this to you. Don't never read any anomaly or any injury unless you know about the normal structure here, because otherwise it is a rote learning only. The moment you will understand the normal structure and what it does, it supply, what that artery supplies, nerve supplies, action of muscle, and then you read about their, about their injury here, that start making more sense here. And that's what whether it is the MD exam or MDS exam, they test you for like too many subjects simultaneously here, and that's why we want to decrease our workload. And the one way to decrease our workload is to work more on your concept and less on the rote learning. बहुत लोग बोलते हैं anatomy is a subject to mug up, there's a lot of rote learning, but I will prove it to you that it is a subject of also concepts here. The more you understand these basic concepts here, the injuries will become easy for you, and the questions are all about the injuries itself here. So I hope, guys, you understood the third nerve, the oculomotor nerve, how exactly it works, what is the location where it goes, what it supplies here, and what could happen because of the injury to the third nerve here. Now, I won't mind if you can tell me in between also that if you're finding the pace is okay and you are able to understand and you're getting enough time to write down also. More importantly is that you're getting the time to write down also, right? So you can just let me know in your Telegram group or on the live chat or in the YouTube also, wherever you feel free. Just do let me know that if everything is going fine. Okay, so in the meantime, let me move on to the fourth nerve, the next nerve in the line. That is the fourth nerve. And what is the fourth nerve, guys? That is the trochlear nerve. The fourth nerve is the trochlear nerve. Now, what exactly is a trochlear nerve? What happens in trochlear nerve is, if let us say this here, once again, is a midbrain. So whether it is a third nerve or it is a fourth nerve, they both will come from midbrain only. That's one thing common. Another common thing, this nerve will also have some relation to the cavernous sinus. So again, that is also same there. We'll discuss the cavernous sinus separately also, but you should know that they have some relation to cavernous sinus. Again, the same story, superior orbital fissure. The fissure they will go through is a superior orbital fissure. I'm writing SOF once again. And what is the muscle to be supplied by the fourth nerve, guys? The only muscle supplied by the fourth nerve is the superior oblique muscle. That's where the mnemonic is SO4. SO4, that means superior oblique is by fourth nerve. Superior oblique is by fourth nerve, the SO4. SO4. Okay, so see, now this time the fourth nerve is very, very different from the third nerve because उसके बहुत सारे reason है. Now first of all, let's do the same thing, guys. Let's divide the midbrain in two parts, right half and the left half. Here is the fourth nucleus. Just like third nucleus, this is a fourth nucleus. That is a trochlear nucleus here. But what happens is, guys, generally आप क्या expect करते हो कि the nerve will start from the brainstem और वो उसको आगे जाना है. That will go forward. Not in this case here. It is the only cranial nerve which will go first backward. So fourth nerve will go backward first, and then what you will see that it will decussate inside the midbrain. Look at that. Now can you see the nerve coming out and decussating here? It is crossing over. So right wala nerve will go toward the left side, left wala nerve will go toward the right side. So the nerve is going backward, they're crossing over, they're decussating. And after decussating, if I just focus on one side nerve only, so this will wind around the entire midbrain, and then rest of the story is exactly the same. Same story aage se. It is also running in which wall of the cavernous sinus? In the lateral wall of cavernous sinus. It is also going through which fissure? Superior orbital fissure. And then it is going to supply what muscle? The superior oblique muscle. So the one major change that you will see in the third nerve and fourth nerve is the third nerve is coming out from the front, and fourth nerve is basically coming out from the dorsal aspect here. So guys, couple of important points to be noted. Point number one, it is the only cranial nerve. It is the only cranial nerve which emerges from what aspect? Dorsal aspect of brainstem. Which emerges from the dorsal aspect of brainstem. Nerves, they generally come from the ventral aspect, from the anterior aspect of the brainstem, but not in this case. It is the only nerve coming from the dorsal aspect of the brainstem. Now, lower motor neuron decussate inside midbrain. अब ये भी अलग है, थोड़ा अजीब है. Generally ऐसा होता नहीं है, guys. Lower motor neurons, they don't decussate here. It's the upper motor neuron which will decussate here. But in this case, you can see the nerve coming out of the nucleus. Nucleus के बाद जो nerve है, that is lower motor neuron. And those lower motor neurons, they are crossing over, they are decussating. So lower motor neuron are decussating inside the midbrain. Now, look at this picture here and make up your mind by yourself. If a nerve is coming out from the dorsal aspect of brainstem, so first of all, nerve को पहले पीछे जाना है. Then the nerve has to surround the entire brainstem, and then the nerve will go into the cavernous sinus and all that here. That means this nerve has to travel a very long distance to reach the cavernous sinus, and for that reason, this nerve is regarded as having the longest. This nerve is having the longest intracranial course. The fourth nerve is having the longest intracranial course. सबसे लंबी nerve है cranial cavity के अंदर. The nerve is having the longest intracranial course. Longest intracranial course. And also to be noted that this is the thinnest cranial nerve available, guys. It's the thinnest cranial nerve. सबसे thin cranial nerve है. It's the thinnest cranial nerve which is out of the 12 nerves. It's the thinnest cranial nerve also. So these are the 4 important points to remember, and they all could be the question, guys. Only cranial nerve coming from the dorsal aspect of brainstem. The nerve in which the lower motor neuron decussates inside the midbrain. Longest intracranial, the nerve which is having a longest course inside the cranial cavity. And also the thin nerve. It is the thinnest cranial nerve which is seen out there. That's the thinnest cranial nerve as well. So that's about the fourth nerve. Now what will happen because of fourth nerve injury? Because fourth nerve injury means only one muscle is gone, that is superior oblique. And when the injury is to the superior oblique muscle, the patient will have a diplopia. So double vision hoga. So you can just remember simply here that fourth nerve injury. If the fourth nerve is injured, there will be diplopia. Double vision. The double vision. You will see the patient will tilt the head to one side actually to counterbalance it. So it is called as a diplopia. Double vision will be there if the fourth nerve injury will be there. So nothing much in that fourth nerve here. Third nerve ki injury se zyada question puchte hain. So that was the third nerve and that's the fourth nerve here. So these are the 2 cranial nerves till now we talked about here. As we said, our plan today is to cover up all the cranial nerves. So we're done with the third nerve and the fourth nerve. Right, that's third and the fourth nerve here. It seems that you people are not very interactive in the group here, but I would like you people to ask me questions, be present in the group here. I'll be really rather happy if you will post anything in the live chat in the YouTube or in the Telegram group, so that basically the live session should be like this only. The live should be like live only. It feels like I am also live. I can answer your queries directly, and you can also interact with me directly on the channel itself. So if whatever you feel like here, whether it is about the you're understanding it, you're not understanding it, is it going fast, is it going good? So whatever it is, you can just let me know freely in the Telegram group or on the live chat in the YouTube. Okay, chali guys. With that, moving on. Now, third nerve is done, fourth nerve is done, and now let me take directly to the sixth nerve, because we first are covering the nerves which are supplying the muscles of the eyeball. So sixth nerve, which is basically called as the abducent nerve. Sixth nerve is the abducent nerve. You know, the word abducent came from abduction. It will do the abduction of the eyeball. This will take the eyeball away. So we call it abducent nerve. Abhi thoda sa difference is story mein. There's a little difference in the story for the sixth nerve and the other nerves that we discussed here. The difference is third nerve and fourth nerve, they were both starting from where? From the midbrain. Thank you, Sonal. I mean, that's the kind of message I want, so that I know that there are people watching me live right now. This time, the nerve will not start from the midbrain. The nerve will start from the pons. Now, that's the main difference here. But the sixth nucleus is present in the pons. Third and fourth nucleus are present where? In the midbrain. But sixth nucleus की situation होती है pons के अंदर. It is situated in the pons. And cavernous sinus तो ऊपर ही था. Cavernous sinus is higher above. This is cavernous sinus, which is present at the level of midbrain only. That is cavernous sinus. Again, the same thing, that is superior orbital fissure. And this time there is only one muscle which we need to supply, and the only muscle that we have to supply here is the lateral rectus. So that's a superior orbital fissure. And here is the cavernous sinus. That once again, that is the cavernous sinus, guys. That's a cavernous sinus, superior orbital fissure, lateral rectus. The only thing which I would request you is to draw this a little higher here. Cavernous sinus is a little higher because it is at the level of the midbrain. Abhi nerve kahan se start hoga? Pons se. So the nerve will start from the pons and that will ascend upward. Now this will create all the difference here. Because sixth nerve will start below and will ascend upward, this will create the difference. Sixth nerve will ascend upward to reach the cavernous sinus. One thing. And second important thing is, this nerve is not present in the lateral wall. This is the only cranial nerve which is present inside the cavernous sinus. ये अंदर से होकर जाएगा cavernous sinus के. So this nerve is basically running through the cavernous sinus, and then through the superior orbital fissure, and ultimately supplying the lateral rectus muscle. So as a third nerve and fourth nerve, you saw they were present in the lateral wall, but this nerve is basically running through the cavernous sinus. It is running inside the cavernous sinus. It is running inside the cavernous sinus. Okay, now look, because the third nerve is ascending upward, so one thing that you need to note here for this nerve is, this nerve, sixth nerve, is basically having the longest what course? Longest intradural course, guys. Not intracranial, intradural. Dura matter ke andar it travels for a very long distance, so it is having a longest intradural course. The nerve is having the longest intradural course. Then, when this nerve is having a longest intradural course and it goes above toward the cavernous sinus, what you will see, that the nerve is related to the apex of petrous temporal bone, which is quite sharp. Apex of petrous temporal bone. I'll tell you more about the apex of petrous temporal bone in the osteology part actually. Apex of the petrous temporal bone. So this nerve is basically related to the apex of the petrous temporal bone, and this apex of petrous temporal bone, as I drew it over there, it is a little sharp. ये थोड़ा sharp होता है. Now, what is the important thing to be noted here, guys? First of all, the nerve is having a longest intradural course here. And then what you can see, when the nerve is ascending upward, it is very close to the apex of petrous temporal bone, which is a vulnerable site for the injury also. Agar मान लो, if the intracranial pressure will increase. Now, what you know, guys, if there is an increase in the intracranial pressure, the entire brainstem will descend downward. अगर प्रेशर इंक्रीज होगा अंदर, एक्स्ट्राड्यूरल हेमरेज है, ट्यूमर है, whatever the reason could be, if the intracranial pressure will increase, then your entire brainstem will be pushed downward. When the brainstem will be pushed downward, this nerve will get injured at this point here. The nerve can get injured at this point here. So that is a question here. आपसे पूछ सकते हैं that which nerve is most commonly injured in the increased intracranial pressure? And the answer is sixth nerve. So sixth nerve or the abducens nerve is most commonly injured in increased ICP, in increased intracranial pressure. It's most commonly, sixth nerve is most commonly injured in increased intracranial pressure because of its anatomy. Look at the apex of this bone; it is very close to the nerve here, and that's why the nerve can get injured here. जैसे intracranial pressure increase होगा, brainstem नीचे की तरफ जाएगा, and the nerve can get injured at this point here, right? That's the nerve most commonly injured in the increased intracranial pressure. Now, let's say if the nerve is injured. Now, what will happen, guys? Now, when there is a sixth nerve injury, obviously in the sixth nerve injury, if it is a case of sixth nerve injury, what will happen? Now, obviously, which muscle will be gone? Lateral rectus muscle will be gone. And when lateral rectus muscle will be gone, now this time the eyeball will not go toward the lateral side, will come toward what side? Medial side. So it will be ipsilateral medial squint. Either you call it medial squint or you can call it convergent squint. और ये कुछ ऐसा दिखाई देगा. Let us say this is a normal eyeball. This is a normal eyeball, no problem with that here. And this here is a convergent squint. Look at that. In this, the eyeball is coming toward the medial side. That's a convergent eyeball, convergent squint, or you can say medial squint. So that's how the eye will look like in case of the sixth nerve palsy. That's how the eyeball will look like in the sixth nerve palsy. So guys, this is about the three cranial nerves supplying the extraocular muscles. I hope if you get any question on these three nerves, you should be able to answer them here. Third nerve, guys, third nerve is supplying all the muscles except SO4 and LR6. You also saw that. Let me just take you back. What we discussed in the third nerve was the third nerve was running in the lateral wall of cavernous sinus, dividing into upper and lower divisions, supplying all these extraocular muscles. We also said Edinger-Westphal, a special nucleus. Edinger-Westphal will also run with the third nerve, and then it will go and relay into what ganglion? Ciliary ganglion. And then from ciliary ganglion, the fibers will come out to supply the sphincter pupillae and ciliaris muscle. The injury to the third nerve बहुत ही elaborate injury है. If a patient comes to a third nerve injury, तो उसकी eyeball कुछ ऐसे होगी. The eyelid will be drooped, नीचे की तरफ drooped होगा. Eyeball is also abducted outside, and you can say it's turned downward also. So we have a ipsilateral ptosis, we have a divergent squint, we have a downward rotated eye also. And obviously there is a loss of light reflex as well as accommodation reflex. Light or accommodation, दोनों reflex का loss होगा. In the trochlear nerve, the only special feature of the trochlear nerve is that the fourth nerve was basically winding around the brainstem. पूरा midbrain के पीछे से घूम के आ रहा था, and then was coming and having the same course like the third nerve only. And that's why the fourth nerve is having the longest intracranial course here. And it is also one of the thinnest cranial nerve. Sometimes you identify this nerve based on the thickness only. So it is the thinnest cranial nerve as well. Okay, now moving on. Finally, then we said the sixth nerve. The sixth nerve, guys, the speciality of the sixth nerve is it is coming from the pons. The nerve will ascend upward to reach the cavernous sinus, runs through the cavernous sinus, through the superior orbital fissure, and then supplies lateral rectus. So यहाँ पर जो एक major change आपको दिखा कि the nerve is present inside cavernous sinus. Moreover, it is coming from the pons. The nerve is running obliquely, so it is having a longest intradural course. Intradural course is quite long, and whenever you have an increased intracranial pressure, sixth nerve can get injured at this point here, at the apex of petrous temporal bone. And if there is a case of sixth nerve injury, obviously, lateral rectus muscle chala jayega. If the lateral rectus is gone, the eyeball will come toward the medial side, so it leads to the medial squint, or you can say convergent squint. Either you call it medial squint or convergent squint. So that's about the third nerve, fourth nerve, and the sixth nerve, guys. So with that, we're done with the cranial nerve supplying the muscles of the eyeball here. Chalo, let's now go to the fifth nerve, guys. Let's talk about the fifth nerve, a very, very important cranial nerve for that matter. The fifth nerve. Now, there are three parts of the fifth nerve. The trigeminal nerve is having three parts, and I'm pretty sure, especially as a dentist, I mean, it's a very, very important nerve for you to know about the distribution of the nerve, where it can cause the sensory loss, especially about the maxillary nerve and mandibular nerve, because they're supplying the gums and teeth and alveoli. So that's why the nerve becomes a little important for us. So guys, fifth nerve ki teen part hai. We got an ophthalmic nerve, that is V1. That is maxillary nerve, the V2. and then we have mandibular nerve. Now, out of ophthalmic, maxillary, and mandibular nerve, ophthalmic and maxillary nerve, they are purely sensory in nature. These nerves are sensory nerves, guys. These are sensory nerves. Whereas mandibular is a special nerve because it is a mixed nerve. It is sensory also and motor also. Some function are sensory, some function are motor. So it's a mixed nerve here. So ophthalmic and maxillary are sensory, and mandibular nerve is a mixed nerve. Mandibular nerve is a mixed nerve. Okay. Let's take the ophthalmic nerve and maxillary nerve first, and then we will talk about the mandibular nerve, guys, for that matter. Okay. Now I want you to imagine something. Up imagine karo, you're looking at a skull bone from the side here, guys. Just imagine only. Let's say you're looking at a skull bone from the side here. Now this is the orbit part here. That is the orbit. Then here is the maxilla, and then is a mandible here. Orbit, maxilla, mandible. Orbit, maxilla, mandible. So let us focus only on the orbit and the maxilla. Let's focus on the orbit and the maxilla for now. So guys, it is something like this. Imagine if this here is a superior orbital fissure, and that is the orbit. Right, eyeball will be there. I don't have to draw the eyeball. That is, eyeball will be there. And the bone which will be present below here will be the maxilla. This bone here is the maxillary bone. I'm drawing a maxillary bone with some maxillary teeth also. So let's say there's a maxillary bone, and all these are maxillary teeth. I'm sorry, all my teeth looks like incisors only, but like just a schematic line diagram only. So this is a maxilla here. This bone is maxilla here, and that is the orbit above. अब समझते हैं about these two nerves, guys, ophthalmic and maxillary nerve. See, both ophthalmic and maxillary nerve, they're coming from a ganglion which is present inside the cranial cavity, and that ganglion is called as a trigeminal ganglion. I'll tell you more about the trigeminal ganglion in the a little later part here. So let's say there's a ganglion there. This is called as a trigeminal ganglion. This ganglion here is called as a trigeminal ganglion. So you have three parts of trigeminal ganglion. One is called as a ophthalmic. Then we have maxillary, and then we have mandibular. अभी mandibular तो हम discuss कर नहीं रहे यहाँ पे, so let's focus on the ophthalmic and maxillary. So this is a trigeminal ganglion, guys. There, this is the ophthalmic division. That's a maxillary division, and that is a mandibular division. Let me put that over there. That is ophthalmic. This is maxillary, and this one is mandibular division here. So let's focus on one at a time here. Now, what ophthalmic nerve will do, guys? Look at me. Ophthalmic nerve will reach the superior orbital fissure. That I already told you, this fissure here is a superior orbital fissure. And this ophthalmic nerve, before entering into superior orbital fissure, ये तीन branches में divide हो जाएगा. It divides into three branches. One of the branch is called as the frontal nerve. Another branch here is called as a nasociliary nerve. And the third branch here is called as a lacrimal nerve. Now look at these three branches over there, guys. Now, first of all, let me just highlight this area so that you can remember that this is the orbit. This is the orbit part here. Beta pura orbit wala part hai. This is the orbit area. That's the orbit area. And this one here is a maxilla. And I'm sure you all know that inside the maxilla bone, there is a maxillary air sinus also. So that's a maxilla bone, and what I'm highlighting right now here is a maxillary air sinus. That's a maxillary air sinus, right? So I'm looking at the orbit above. Yellow one is the orbit. That area is the orbit, and that is a maxillary air sinus. Now, what you see that ophthalmic nerve, it goes into the superior orbital fissure, but उससे पहले ये तीन branch में divide हो गया. It divides into three branches. One of the branch here, are we, my dear, about the general somatic efferent, special somatic efferent, ये concept मैं करूँगा आपके साथ discuss अलग से. I did not start with that. Generally, I start my head and neck discussion with the cranial nerve nucleus column. But I'll tell you the reason I'm putting it for the later part here, because if you understand the cranial nerve first, आपके लिए easy हो जाएगा to understand that what cranial columns are related to that here. So don't worry, I'll discuss that concept of general somatic afferent, efferent. वो पूरा मैं आपके साथ करूँगा. That's my responsibility. Don't worry. Okay, so there we go. So guys, the three branches over there, we have a nerve which is called as a frontal nerve. There's a nerve called as a frontal nerve. Then we have a nerve which is called as a nasociliary nerve. This nerve is called as a nasociliary nerve, and there's another branch which is called as a lacrimal nerve. So there are three branches. There are three branches of the ophthalmic nerve, that is frontal nerve, nasociliary nerve, and lacrimal nerve. अभी देखो जिसका नाम ही frontal nerve है, the one which you call as a frontal nerve, obviously will come in the front and will supply the skin of the forehead and scalp. So this nerve, let me just write in short for you. The nerve will supply the forehead and scalp skin. The nerve will supply the forehead and the scalp skin. Nasociliary nerve की दो बहुत important branches होंगी guys, and those two important branches of nasociliary nerve will be the anterior ethmoidal nerve and posterior ethmoidal nerve. Ethmoidal, जिनका नाम ही ethmoidal nerve है, तो obviously they will be supplying the ethmoidal air sinus. So we have an anterior ethmoidal nerve and we also got a posterior ethmoidal nerve. Anterior and posterior ethmoidal nerves. They are supplying basically the ethmoidal air sinus here. And lacrimal nerve, as the name suggests, lacrimal nerve will supply the lacrimal gland. Once again, the name says lacrimal nerve will supply the lacrimal gland. So we got a frontal nerve, nasociliary nerve, and lacrimal nerve, and ये इनकी major supplies हैं यहाँ पे. You don't have to go into too much of detail in that here. बस ये ध्यान रखना कि when I say nasociliary, the word ciliary tells you that this nerve is connected to the ciliary ganglion. This nerve is simply connected to the ciliary ganglion. I'm writing CG over there, that is ciliary ganglion. This nerve is connected to the ciliary ganglion. Just note that, please. Nasociliary nerve is simply connected to the ciliary ganglion. So that is about the ophthalmic nerve. Ophthalmic nerve की तीन branches है guys. Frontal nerve, जिसका नाम ही frontal nerve है, that will come in the front and will supply the skin of the forehead and scalp. Then we have a nasociliary nerve which is connected to the ciliary ganglion, and not only that, इस nerve की दो branches भी होंगी which is called as anterior ethmoidal, posterior ethmoidal nerve, जो कि ethmoidal air sinus को supply करेगा, to supply the ethmoidal air sinus. And lacrimal nerve, the name says lacrimal nerve, obviously will supply what gland? The lacrimal gland. So that's basically the function of the the ophthalmic nerve, the major function of the ophthalmic nerve. What maxillary nerve will do and what makes this maxillary nerve so special and different from others? Guys, maxillary nerve will come out of a foramen. Now there is a foramen present in the skull bone, and that foramen is called as a foramen rotundum. I wanted to write down the full form somewhere else, and it is foramen rotundum. I will discuss that in the osteology part with you. So maxillary nerve will come out of the foramen rotundum, and once it comes out of the foramen rotundum, it is also connected to a ganglion, और इस बार ये ganglion अलग है. This ganglion is called as a pterygopalatine ganglion, guys. The name of this ganglion is pterygopalatine, also called as a sphenopalatine. Pterygopalatine ganglion. This nerve is topographically connected to, or you can say simply connected to what ganglion? Pterygopalatine ganglion. I repeat again, maxillary nerve comes out of the skull bone through what? Foramen rotundum. There is an opening in the skull bone in the floor of the middle cranial fossa, that is called as a foramen rotundum. And जैसे foramen rotundum से बाहर आएगा, the nerve is connected to the ganglion called as a pterygopalatine ganglion. Now look guys, this is what I wanted to understand. What you will see here, the nerve will be running in the roof of the maxilla. Basically, this maxillary nerve, the name says maxillary nerve, so it is running in the roof of maxilla. Now, when you say roof of maxilla, it is a floor of what? If it is a roof of maxilla, it is a floor of what? It is floor of orbit. तो या तो आप इसको roof of maxilla बोलो, or you can even call it the floor of the orbit. And that's why this nerve, guys, from this point onwards, and this entire nerve is called as an infraorbital nerve, because it is running in the floor of the orbit. So we also call it the infraorbital nerve. This nerve is called as an infraorbital nerve. Now do remember, infraorbital nerve is from here till here. The entire nerve here till all the way till outside here. This entire nerve is called as an infraorbital nerve. So basically, infraorbital nerve is a continuation of the maxillary nerve only. कुछ अलग नहीं है. It is just the continuation of the maxillary nerve only, called as an infraorbital nerve. Okay. The infraorbital nerve will come out and will supply the skin. Fine. The nerve will come out from here and will supply the skin in this area here. But what this infraorbital nerve will do inside? Guys, this nerve will supply the maxillary sinus inside. अब देखो guys, there are two things to be supplied. Maxilla के अंदर दो चीजें supply करने के लिए. एक तो maxillary sinus, one is maxillary sinus, and another one is a gums and teeth. That means alveoli. Alveolar branches. So there are three alveolar branches which will come from here. One alveolar branch will come from outside like this. another alveolar branch will come like this, and another alveolar branch will come like this here. So these are three alveolar nerves. I'll write down the name of the one. This is called as a posterior because it is present on posterior side. Superior alveolar nerve. Posterior superior alveolar nerve. Beta superior alveolar nerve तो बोलना ही पड़ेगा. All these are superior. This is also superior. This is also superior. This is also superior. So these are three superior alveolar nerve. This one is posterior. This one is middle. This one is anterior. So guys, what is the name of this nerve here? This is called as the middle. This time it is called as the middle superior alveolar nerve. And this one is present anteriorly. So we call it anterior superior alveolar nerve. Middle superior alveolar nerve, and that is the anterior superior alveolar nerve. Anterior superior alveolar nerve. So this is about the maxillary nerve. Broadly, what maxillary nerve is doing? Maxillary nerve beta foramen rotundum se bahar aata hai. It is connected to the pterygopalatine ganglion, and then it continues as the infraorbital nerve, but it is giving off three branches. As you just saw, these three branches are called as the superior alveolar nerve. One is posterior, one is middle, one is anterior. So that's the story of the broad story here. Now there are many details in this which I kind of skipped. I don't have to give you every detail here. Like frontal nerve will divide into two branches: supratrochlear, supraorbital. Lacrimal nerve ki branch will come out to supply the skin. Nasociliary nerve will also give off an infratrochlear nerve. There is a connection between the maxillary nerve and lacrimal nerve. So I'm cutting down those details. Unki zarurat hi nahi hai. Nobody is going to ask you a question on that. Whatever you'll just look here, this is good enough to understand the ophthalmic and maxillary nerve and to answer the questions based on that here. Right? So I hope you understood the ophthalmic and maxillary nerve both in this picture. Now let's talk about the third major part here, that is mandibular nerve. And this is something which all of us have to understand in detail for two reasons, guys. First of all, mandibular nerve anyways is important because it is supplying the muscle of mastication. And I'm sure everyone knows that how important muscle of mastications are. Secondly, mandibular nerve, the name says mandibular nerve, तो बेटा वो mandible के अंदर जाएगा. And if it goes inside the mandible, that nerve will be called as the inferior alveolar nerve. The moment I say the word inferior alveolar nerve, well, I'm sure being a dentist, you will just have up like more attention to this nerve because you have to anesthetize this nerve for any basically intervention you're doing for the lower jaw or for the teeth of the lower jaw. So let's move on to the third nerve, guys. We're done with the ophthalmic, we're done with maxillary. Now let me take you to the third part of this nerve separately. And I request you people to take a fresh page for that. ऊपर से शुरू करेंगे, नीचे की तरफ आएंगे. And let's talk about this mandibular nerve now. Let's discuss this mandibular nerve here. Vishmaya, beta, maxillary sinus supplied by all these three. That's what we said here. Maxillary sinus supplied by all these three. Posterior superior also, middle superior also, anterior superior also. All the three nerves which are branches of maxillary nerve also are supplying the maxillary sinus. So that's the answer. Exactly, Priyam. Exactly. That's how it is here. Posterior superior alveolar nerve is a branch of the maxillary nerve. You can see it is coming out from here. Middle superior alveolar nerve and anterior superior alveolar nerve. अगर आपसे डिटेल में पूछते हैं, middle superior alveolar nerve and anterior superior alveolar nerve are the direct branches from where? They're coming from infraorbital here. So that also is correct here. कि middle superior alveolar, anterior superior alveolar are the branches of infraorbital. Posterior superior you can see directly coming from the maxillary also. Directly coming from the maxillary nerve. Okay, now I feel like I'm talking to you people. I'm seeing you people responding. Thank you, Ruchi, Ketan. You're responding in the YouTube channel chat also and in this group also. That's what I want, guys. Is feel free to ask your questions. You will ask your questions and answer them. If unfortunately कुछ ऐसा पूछते हो आप कि I don't know the answer to that question, so I'll just make sure that I'll fetch the answer and get to you. Okay. Coming to the mandibular nerve, guys. The third part, coming to the mandibular nerve. Now, why mandibular nerve is so important, and we have to discuss this nerve in detail because आप मान के चलो कि you will get at least one question on this nerve for sure. Mandibular nerve and facial nerve, they both are very important, guys. Mandibular nerve is a mixed nerve, right? Now, there is a foramen present in the skull bone, and that foramen, Priyam, my dear zygomaticotemporal nerve, I did not tell you in this case. I don't know if you attended my lecture first, earlier also, that's why probably you're asking this question here. Zygomaticotemporal nerve is a connection between the maxillary nerve and the lacrimal nerve. But there's no need for that. You don't have to know that connection here. Dekho, this is also my responsibility to cut down on unnecessary detail here. I could have told you that there is a nerve called a zygomatic nerve which is dividing into two branches, and zygomatico-temporal is joining with lacrimal. But zarurat nahi hai. You don't have to know that now, so don't worry about it. Okay, so guys, coming to the mandibular nerve, now there is a foramen present, and this foramen is called as the foramen ovale. I'm sure you all read about foramen ovale, that oval foramen present in the skull bone, that is called as foramen ovale. Now, foramen ovale give passage to the mandibular nerve, and that's how the trunk of the mandibular nerve will come out. Now, this is a trunk. This is a trunk of the mandibular nerve, first of all. There is a trunk of the mandibular nerve. Okay, before the mandibular nerve divides into the anterior and posterior division, now there is a lot a mandibular nerve is doing. Like there are four important things about the mandibular nerve, trunk only. Trunk के ऊपर ही चार question है. Question number 1. The trunk of the mandibular nerve will give off a branch, and this branch will go back into the cranial cavity. ये वापस जाएगा ऊपर. It goes back into the cranial cavity to supply the dura mater, and this nerve is going through a foramen called as the foramen spinosum. This goes through a foramen called as a foramen spinosum, and for that reason the nerve is also called as a nervus spinosus. This is called as a nervus spinosus. So the trunk of the mandibular nerve, it gives off a branch which goes back into cranial cavity, that is called as a nervus spinosus, guys. The moment you say the word nervus spinosus, obviously foramen spinosum se pass kar raha hai. And understand one thing, that whenever you have a nerve going back into cranial cavity, a nerve going back into cranial cavity is going for one reason only, and that is to supply the dura mater. और कोई reason ही नहीं है. The only reason a nerve can go back into the cranial cavity is to supply the dura mater. This is one of the major nerves supplying the dura mater, guys. This is one of the major nerves supplying the dura mater, guys. It's a major nerve supplying the dura mater, which I will discuss with you separately when I'll tell you more about the dura mater. So it's a main nerve supplying the dura mater. DK, you're asking me, I don't know whether you're asking me or you're telling me that MBBS student to attend your lecture. Well, why not? Head and neck to MBBS ho ya BDS ho, sabke liye hi hai. So you're most welcome to join this lecture, and I'm sure you will be benefited. So guys, trunk of the mandibular nerve gives off a branch which goes back, and that is basically the nervus spinosus, and that is supplying the dura mater. Okay, what about that's one thing here. The second part. The second thing about the trunk is, the trunk of the mandibular nerve, it supplies only one muscle of mastication. Now, I hope that all of you know about, there are four muscles of mastication: temporalis, masseter, medial pterygoid, and lateral pterygoid. Temporalis, masseter, medial pterygoid, lateral pterygoid. But out of these four muscles of mastication, only medial pterygoid is supplied by the trunk. Medial pterygoid is the only muscle of mastication supplied by the trunk. But हम trunk की बात कर रहे हैं अभी. We're just talking about the trunk only. अभी division का तो बात ही नहीं आया है. So trunk supply gives off a branch called as the nervus spinosus. Trunk supplies only one muscle of mastication. Very important question. Trunk supplies only one muscle of mastication, and that is medial pterygoid. Next important thing. The same nerve which is supplying medial pterygoid, it also supplies the two muscles जिनके नाम में टेंसर आता है. टेंसर. What are the muscles with the name tensor? We have a muscle called as a tensor veli palatini and tensor tympani. That's the next important thing, guys. Tensor veli palatini and tensor tympani. I give you time to write down the full form that you want. The tensor veli palatini and tensor tympani. Thank you, DK. Tensor veli palatini and tensor tympani. If you look at the head and neck, there are two muscles which इनके नाम में tensor आता है. Tensor veli palatini and tensor tympani, and they both are supplied by the same nerve which is supplying medial pterygoid. So that's the third important information from the trunk here. Now, fourth and the final important information from the trunk is that the trunk of the mandibular nerve is connected to a ganglion, and that ganglion is called as the otic ganglion. That is the otic ganglion. So these are the four important and straight questions asked from the trunk of the mandibular nerve. What are the 4 important questions, guys? It gives off a nerve called as the nervus spinosus, which is the major nerve supplying the dura mater. It supplies the only muscle of mastication, that is medial pterygoid. It supplies the 2 tensor muscles also, tensor veli, palatini and tympani. And it is connected to what ganglion? The otic ganglion. It is connected to a ganglion, aortic ganglion. Till now we saw the connection of ciliary ganglion, pterygopalatine ganglion, and now we're looking at the aortic ganglion also. Aortic ganglion also. So guys, this is about the trunk here, and that's a 4 important thing about the trunk here. Now let's move from here. Abhi trunk ke baad kya hoga? After trunk doing all this, the mandibular nerve will divide into an anterior and posterior division. So what you will see, that this nerve is going to divide into anterior and posterior division. So let us say, if this here is an anterior division, and this is a posterior division. I'm just drawing a schematic diagram for you. DK facial nerve, nahi beta, facial nerve supplies tensor what? It supplies the stapedius muscle, not tensor tympani. Facial nerve supplies the muscle of middle ear, but that is not the tensor tympani. It supplies the stapedius muscle. So there we go, guys. The 2 division there, the anterior and the posterior division. So let me take one at a time. Let's say this is AD, anterior division, and this is PD, that is posterior division. Just a schematic diagram here. Now what anterior division will do, anterior division will supply the remaining 3 muscles of mastication. Which muscle is done? Medial pterygoid is done. And look at the 3 muscle here. It is going to supply the muscle that is lateral pterygoid. It supplies the muscle that is lateral pterygoid. It supplies the muscle with the name of masseter. And it supplies the muscle with the name of temporalis. Right? So 3 motor branches. Obviously that's a motor branch. It is supplying a muscle. It's a motor branch. This also is a motor branch. This also is a motor branch. So 3 motor branches are coming from the anterior division. But there is only one sensory branch coming from the anterior division. And that nerve is called as the buccal nerve. That nerve is called as a buccal nerve, and this is I'm writing S for it. It is a sensory branch here, and that's a question also. कि mandibular nerve के anterior division से, guys, from the anterior division of mandibular nerve, only one sensory branch is coming, and that sensory branch is a buccal nerve. Now I'm pretty sure that you people know what is the meaning of the word buccal. Buccal means what? Cheek. Anything which is related to cheek is called as a buccal. So what this buccal nerve will do? It's a sensory nerve. अभी sensory nerve है तो it will supply the skin of the cheek area, and it will also supply the mucosa of the cheek area. Now see, I'll tell you what is the catch and what question is asked from this. Buccal nerve, it supplies skin and mucosa. It supplies the skin and mucosa of cheek. It is supplying the skin and mucosa of the cheek here. A problem ये है कि when you have to supply the skin as well as mucosa of the cheek, you have to pierce the muscle also in between. जो बीच में muscle है उसको pierce करना पड़ेगा आपको. So that means it also pierces buccinator. It also pierces the muscle that is buccinator muscle. But see, what makes it special? Piercing buccinator doesn't make it special. Generally, what is a rule in the anatomy that if a nerve is piercing a muscle, it should supply it also. If a nerve is piercing a muscle, it should supply it also. There are many examples that you will see in the body where the nerve is piercing a muscle and supplies it also. अगर आप वहाँ रहोगे तो किराए पे तो देना पड़ेगा ना, but not in this case here. Guys, buccal nerve, it pierces buccinator, but still doesn't supply it. It's a sensory nerve. Sensory nerve कैसे supply करेगा? Muscle को कैसे supply करेगा? So it supplies the skin and the mucosa of cheek. It also pierces the buccinator. The important thing but doesn't supply buccinator. But doesn't supply buccinator. Buccinator को supply नहीं करेगा. उसको pierce कर रहा है, but doesn't supply it here. But it doesn't supply it here. So that's about the anterior division, guys. This is about the anterior division. So anterior division, I repeat again, it is giving 3 motor branches to the remaining muscle of mastication, that is lateral pterygoid, masseter and temporalis. It gives off one sensory branch, which is a very good question to ask. Buccal nerve, buccal means cheek. So this nerve is supplying the skin of the cheek, अंदर से mucosa of the cheek, pierces buccinator, but doesn't supply the buccinator. Then comes posterior division, guys. Now what is so special about the posterior division? Posterior division gives off three branches, and you can remember these three branches with a mnemonic that is Ali. Ali. The mnemonic for the posterior division is Ali. A-L-I. Now what is A? Ali ka A is auriculotemporal nerve. It is auriculotemporal nerve. Auriculotemporal nerve. Now I want all of you to just give yourself a couple of seconds and think about this name, guys. Auriculotemporal. Auricle and temple. Auricle, this is auricle here, right? And this is temple here. So if I put my hand on the auricle and temple, now let's see what is there under my hand, guys. ये पूरा auricle and temple वाला region है, auriculotemporal. So this nerve must be supplying the skin of the auricle, upper part of the auricle here. It must be supplying the skin of the temple region here. This region of the ये scalp का इस वाले region को supply करेगा. What else, guys? What is the joint here? The joint here is temporomandibular joint. And obviously, what is the gland present here? That is the parotid gland also. So parotid gland, TMJ, auricle, temple, ये पूरा area is supplied by this auriculotemporal nerve. Just put your hand on this area and you can realize that what it exactly supplied by this nerve here. So auriculotemporal nerve supplies the skin it supplies the skin of auricle and temple. It supplies the skin of the auricle and temple. That is one thing. It supplies temporomandibular joint. And it also supplies the parotid gland. It also supplies the parotid gland. That's the property of the auriculotemporal nerve, guys. It supplies the skin of the auricle and temple. इस area को skin को supply करेगा. It supplies the temporomandibular joint, TMJ, and it is also supplying the parotid gland. So that's A of Ali. That is A of Ali. Come to L. L is for what? Lingual nerve. The next nerve that you're talking about here is the lingual nerve. Now, guys, lingual nerve is connected to a ganglion. First of all, now coming to this last ganglion here, हम already 3 ganglion देख चुके हैं. This ganglion here is called as a submandibular ganglion. I'm writing in short. You can write it separately somewhere. SMG, submandibular ganglion. So lingual nerve, first of all, is connected to this ganglion called as a submandibular ganglion. It is connected to the submandibular ganglion. And जिसका नाम ही lingual nerve है, so obviously it is going to supply the tongue. So this nerve is basically supplying the anterior 2/3 of tongue. Now what exactly it is doing on the anterior 2/3 of tongue? It is taking the general sensation from there. So this nerve is responsible for collecting the general sensation from anterior 2/3 of tongue. General, not the taste sensation, guys, only the general sensation. This nerve is basically collecting the general sensation from the anterior 2/3 of tongue. In simple word, अगर मैं बोलता हूँ general sensation, like what is the general sensation? Pain, temperature, touch, pressure, ये सब general sensation है. If you're having a cup of coffee, the temperature of the coffee is a general sensation. Isn't it? आप जब कॉफी पी रहे हो तो आपको टेम्परेचर फील हो रहा है कि कॉफी हॉट है या कोल्ड है, तो दैट इज अ जनरल सेंसेशन. बट द टेस्ट ऑफ द कॉफी, द स्वीटनेस, द डिफरेंट काइंड ऑफ टेस्ट दैट वी हैव अ कॉफी टी, ऑल द टेस्ट ऑफ द कॉफी इज अ स्पेशल सेंसेशन. So this nerve is not for the special sensation. It is not carrying the taste. It is carrying the simple, the general sensation. The pressure, अगर आपके टंग पे कट लग जाए, the pain sensation, all those are carried by the lingual nerve. The general sensation from the anterior 2/3 of tongue. So ultimately that was A and L, and now coming to undoubtedly the most important nerve, and that is the I. I is what? Inferior alveolar nerve. I'm sure the moment I say inferior alveolar nerve, we all know about this. Inferior alveolar nerve is a nerve going inside the mandible. Now to make you understand this nerve a little better, let me draw the mandible for you guys. Ab imagine karo, if this is a mandible here. If this here is a mandible bone, and let's say these are all mandibular teeth and gums there. So what you will see, that nerve we are talking about here, inferior alveolar nerve, this nerve will go inside the mandible, or beta mandible के अंदर there is a canal present over there called as a mandibular canal. So this nerve will run inside the mandibular canal. It keeps running inside the mandibular canal like this, and ultimately the nerve will come out of the foramen present here at the chin region here. That is called as a mental foramen के रूप में बाहर आएगी ऐसे. So first and the foremost, this nerve is called as what? That is called as the inferior alveolar nerve. This nerve is called as the inferior alveolar nerve. Again, look at the name, guys. Inferior alveolar, alveoli, obviously supplying the lower gums and teeth. So when this nerve is running in the mandibular canal, so this nerve is giving off numerous branches to supply the lower gums and the teeth. Lower gums and teeth are supplied by this nerve, and that's why the name is inferior alveolar nerve. And after supplying the lower gums and teeth, the nerve will come out in the form of what nerve? In the form of the mental nerve. In the form of mental nerve, which is supplying the skin of chin area. Which is supplying the skin of the chin area. Now, this is something which I'm pretty sure all of you must have experienced, that the moment you give the anesthetic agent to the inferior alveolar nerve, जैसे आप inferior alveolar nerve पे anesthetic agent देते हो, तो you must have, obviously your lower jaw will get anesthetized here, right? But the patient always also feel a sensory loss where? On the chin, lower lip. This entire area will have the sensory loss here for the moment here. The anesthesis will have a will have an effect on the lower lip also and on the lower jaw also and some part of the tongue also. Because of what nerve? Inferior alveolar nerve. Because inferior alveolar nerve is not only supplying the lower gums and teeth, it is also supplying the skin of the chin area also. Skin of the chin area. Okay. Now, is this the only thing about inferior alveolar nerve? No, guys, there is one more thing here. Now, inferior alveolar nerve, before it goes inside the mandible, inferior alveolar nerve will give off a branch, and this branch will come down and will supply two muscles. There are two muscles present here. Which are supplied by the same inferior alveolar nerve, and these muscles are called as the mylohyoid and anterior belly of digastric. That again makes it very important. Mylohyoid and anterior belly of digastric. The nerve is simply called as nerve to mylohyoid. इसको बोलते तो हम nerve to mylohyoid, but as you can see, it is supplying the anterior belly of digastric also. So these are two muscles present here, forming the oral diaphragm. Nerve to mylohyoid and anterior belly of digastric. So that's the whole story about the Ali. Auriculotemporal nerve supplying the auricle, temple, parotid gland, TMJ. Lingual nerve supplying the tongue. That is basically carrying the general sensation from anterior two-third of tongue. And then we have inferior alveolar nerve, which is basically running inside the mandible, supplying the lower gums and teeth. Comes out as mental nerve to supply the skin of the chin area. But mandible के अंदर जाने से पहले, before going inside the mandible, it gives off a branch which supplies the anterior belly of digastric and a mylohyoid muscle. The two muscles present in the oral diaphragm. The two muscles present here in the oral diaphragm. So guys, this is about the mandibular nerve. Now, आप ये मान के चलो कि you will get one question from what you're looking at the screen right now here. Everything, guys, top to bottom, everything here is important here. Mark my words, you will get a question from this part here. So whether it is a only muscle of mastication supplied by the trunk, which two tensor muscle are supplied by the the mandibular nerve, what is the main nerve supplying the dura mater, that is nervus spinosus, which ganglion is connected to the trunk, otic ganglion. Anterior division key, what is the only sensory branch, that is a buccal nerve supplying the skin, the mucosa, piercing buccinator. And obviously Ali mein all three, ALI, all three are equally important, especially inferior alveolar nerve for you people is more important here. So that's about the mandibular nerve. Now, well, obviously, let's talk about that. How the patient will come to you if he's or she is having a mandibular nerve injury here. अभी ophthalmic nerve का injury किसी को है या maxillary nerve का injury है तो obviously sensory loss होगा. There will be sensory loss in the forehead area. There will be sensory loss in the maxillary area. But when the mandibular nerve is injured, then your muscle of mastication will get affected here. Medial pterygoid will get affected. Lateral pterygoid will get affected, masseter, temporalis. So muscle of mastication will not work. Now, I'll tell you something about the action. Although we'll discuss that in the TMJ, I've discussed that already as one of the demo lecture for you in the temporomandibular joint. One of the function of temporomandibular joint, one of the function of mastication muscle is to push the mandible. Right side ka muscle will push the mandible toward the left side like this. You can see my jaw right now is toward the left side. Now that is because of the right side pterygoid muscle pushing it. Similarly, left side pterygoid will push the mandible toward the right side. That means both the muscle will counterbalance each other. दोनों counterbalance कर रही हैं. These pterygoids are counterbalancing these pterygoid here. But let's say if one side pterygoid will not work, if the right side pterygoid muscles will not work, then obviously these pterygoid will take over. So if you have an injury of the mandibular nerve on the right side, and your right side pterygoid is not working, then these muscles will put a pressure, will put a force and take your jaw toward the right side only. So जिस side का injury होगा nerve का, उसी side पे आपका jaw deviate कर जाएगा. So if I come to your clinic and my jaw is like this, then you will say it is because of the left mandibular nerve injury. Whichever side jaw is present, whichever side the jaw is deviated, same side nerve injury is there here. So that's one thing, that in case of the mandibular nerve injury, there is ipsilateral jaw deviation. But the same side पे jaw deviation होगा. There is a ipsilateral jaw deviation. Ipsilateral jaw deviation. It's a very simple thing. The patient will come to you. एक side में मुंह टेढ़ा होगा उसका. जिस side पे टेढ़ा होगा, जिस side पे deviation होगी mandible की, the same side mandibular nerve is injured here. The same side mandibular nerve is injured. बेटा आरवी इंफीरियर एल्वियोलर नर्व को जब ब्लॉक करते हैं तो लिंगुअल नर्व हो जाती है कई बार. फेशियल नर्व नहीं, फेशियल नर्व तो बहुत दूर होता है. फेशियल नर्व इज आउटसाइड. फेशियल नर्व का तो लेना देना ही नहीं बेटा वहां से. व्हेन यू पुट एन इंजेक्शन टुवर्ड द इंफीरियर एल्वियोलर नर्व, द नर्व व्हिच इज वेरी क्लोज टू दैट इज अ लिंगुअल नर्व. दिस नर्व, लिंगुअल नर्व, ये दो नर्व बहुत पास होती हैं. लेट मी ट्राई टू डेमोन्स्ट्रेट दिस फॉर यू. लेट्स से अगर ये मेरा मैंडिबल है, if my right side mandible is there, the nerve which is going inside the mandible, जो mandible के अंदर जा रही है, that is inferior alveolar nerve. The nerve which is coming medial to the mandible, जो टंग में जा रही है, that is lingual nerve. पर दोनों है तो बहुत पास यहाँ पे. So when you put the needle inside and you try to block the inferior alveolar nerve, you accidentally can block the lingual nerve. तो आप चाहते तो हैं inferior alveolar nerve को block करना, but lingual nerve आपकी block हो जाती है यहाँ पे in that case. So that's the common mistake which is done during the blocking of the inferior alveolar nerve. Facial nerve का कोई लेने देना है बेटा. Facial nerve तो बहुत बाहर है. Facial nerve is more outside. Okay. Chalo guys, so this is about the trigeminal nerve. I hope I'm able to make you understand that how the three parts of the trigeminal nerve. देखो, anatomy of the head and neck is very much dependent on these three nerves. हम आगे जो भी topic discuss करेंगे, you will realize that how this trigeminal nerve is so important. क्योंकि बार-बार इसका जिक्र आएगा, so you need to understand these nerves very well. So I expect when we'll have our next session after today, so next time आप please इस topic को जरूर ठीक से पढ़ के आइएगा about the cranial nerves. It will really help you to understand the rest of the anatomy of the head, neck and face. Okay, now with that, let me just take you to the next nerve. अभी इसको हम दो पार्ट में करेंगे. I'll discuss a part of this nerve before the break. I'll give you a small break after that, and then discuss rest of the nerve after that. And that nerve is the facial nerve, guys. Let's talk about the facial nerve. और कहने की जरूरत नहीं है. I'm sure all of you know that how important the facial nerve is. Mandible. If I have to suggest you only two nerves. Like you have to read other nerves also, but the two most important nerve that you should read very well, one is the mandibular nerve and one is the facial nerve. Well, maximum chances of getting a question from these two nerves here. Guys, facial nerve. See, what type of nerve is a facial nerve? It is also a mixed nerve. Although facial nerve is known for supplying the muscle of facial expression, but ये इसका अकेला ये function नहीं है. Facial nerve is quite a complicated nerve. The main part of the facial nerve is not outside. जो हम देखते हैं facial nerve का part, that is not the main part here. The main part of facial nerve is inside, जो अंदर supply कर रहा है, which is supplying the submandibular gland, supplying lacrimal gland, supplying the middle ear. So though that part is very, very important here. So let us understand this mixed nerve, that is the facial nerve. Okay, so I request you people to start again from the top of the page and एक corner से शुरू करते हैं guys. So let us say this here is the brainstem. So I'm not saying pons, medulla, whatever. Let's simply say it is the brainstem from where the facial nerve will begin. This is the point where the facial nerve will start. Now, what exactly part of the brainstem is that? That we will discuss. I'll tell you more about that in the discussion, the neuroanatomy. Okay. Now, guys, once the facial nerve starts from the brainstem, it goes into the internal auditory canal. I'm pretty sure you all must have seen the internal auditory canal in the skull bone. So there is an internal auditory canal. I'm writing IAM. Guys, you also try to write down in short also, because बहुत सारी labeling हो जाती है ना, तो फिर बाद में confusion होती है यहाँ पे. So just write down in short only. Internal acoustic meatus, or you can say internal auditory meatus. Internal acoustic meatus or internal auditory meatus. Internal acoustic meatus or internal auditory meatus. The other things which I'm first drawing the things which are required to understand the facial nerve. The next thing which is required to understand the facial nerve is the middle ear cavity. Now let's say this box here is for the middle ear. This box here is corresponding to the middle ear, right? चलो अभी इतने फोकस करते हैं. I want the space below this also. I need the space below this also. But उसमें बाद में आते हैं. Let's focus only on this part here. Now what do you see, guys? What is the speciality of the facial nerve? Now facial nerve speciality is to form the genu, internal genu, external genu. So it makes multiple bends. So first bend of the facial nerve तो अंदर ही होता है brainstem के. So what you will see that facial nerve will make a bend like this, will come out, goes into the internal auditory canal, or you can say internal auditory meatus. So that's a facial nerve. Obviously, that's a facial nerve that you're looking at here, right? Now, important thing is facial nerve किस nucleus के around wind कर रहा है? Facial nerve is winding around the 6th nucleus. Look at the number over there, guys. I wrote 7th here, and that is 6th here. So what you see, 7th nerve will wind around the 6th nucleus. If this is the 6th nucleus, your facial nerve will wind around the 6th nucleus, and then it goes out here. So facial nerve winds around the 6th nucleus, and this is what is called as the internal genu of the facial nerve. That is the internal genu. The internal genu. It is inside the brainstem, so we call it internal genu of the facial nerve. Once the facial nerve crosses the internal acoustic meatus, it again makes a sharp bend. और इस बार जब ये sharp bend बनाएगा तो it goes to the medial wall of middle ear. Look at this, guys. Medial wall of middle ear. Medial wall. पहले medial wall पे गया, and then it runs on the posterior wall of middle ear, and ultimately it comes out of the foramen. And I hope you all know about this foramen in the skull that is called as a stylomastoid foramen. That's a stylomastoid foramen. Now, story after the stylomastoid foramen, we will discuss it separately. Let's focus on this part first. So what you saw, that facial nerve makes an internal genu. Facial nerve goes into the internal auditory canal or internal acoustic meatus, and then facial nerve forms two more genu here. Guys, look at this. One bend is here. One bend is here for facial nerve, and one bend is close to the middle ear cavity. So guys, दो external genu है यहाँ पे. This is called as the external genu 1, and this one here is the external genu 2. दो external genu 1, and there is an external genu 2. So they can ask you this question also, that facial nerve is forming how many bends in total? So there are 3 bends of the facial nerve in total. One bend is inside the brainstem called as internal genu. Then we have external genu, first external genu, and then we have second external genu. एक internal genu है, दो external genu, total 3 bend. There are 3 bends of facial nerve. Now, exactly where the external genu 1 is present, at the location of the external genu 1, there is a ganglion present here, and that ganglion is called as a geniculate ganglion, guys. Let me write it here only. This ganglion which is present at the external genu 1, that is called as a geniculate ganglion. That is called as a geniculate ganglion. That ganglion is called as a geniculate ganglion. That ganglion is a geniculate ganglion. Now, what you'll see, that exactly जहाँ पर geniculate ganglion present है, from the level of the geniculate ganglion. Now, understand this. From the level of the geniculate ganglion, a branch of facial nerve will come out, and this branch of facial nerve is called as the greater petrosal nerve. Now, I know most of us have confusion with these petrosal nerves, so this is what my job is, to resolve these confusions here, guys. When I say greater petrosal nerve, so what exactly the greater petrosal nerve is? Beta, greater petrosal nerve का काम क्या होता है? It is going to supply the lacrimal gland. It is a preganglionic nerve, and it is going to supply the lacrimal gland. So greater petrosal nerve, it's a branch of facial nerve. It is a branch of facial nerve. And what this greater petrosal nerve will do कि आगे जाके this greater petrosal nerve will relay in the ganglion, and that ganglion is the pterygopalatine ganglion. ये वही ganglion है बेटा जो हमने पहले लिखा था यहाँ पे. देखो मैं वापस लेके आता हूँ आपको. Look at that. This is the look at that. That's a pterygopalatine ganglion there. So facial nerve की branch आएगी और pterygopalatine ganglion के अंदर आकर relay करेगी. अलग से आ रही है कहीं से. Greater petrosal nerve will come separately from somewhere and will come and relay into this ganglion, pterygopalatine ganglion. अब आप मुझे बताओ, guys, all of you, please look at the screen here. This is very important point here. Now, once once the nerve comes into the pterygopalatine ganglion, और मान लो मुझे जाना है pterygopalatine ganglion से lacrimal gland तक, तो मैं कैसे जाऊंगा? Now from the pterygopalatine ganglion what will happen? The fibers will go into what nerve? Maxillary nerve. पहले maxillary nerve जाएंगे, फिर maxillary nerve से connection होगा, and that connection of the maxillary nerve will join with what nerve? Lacrimal nerve, and then lacrimal nerve will supply what gland? Lacrimal gland. That is how the lacrimal gland is supplied. Imagine करो, फेशियल नर्व की ब्रांच है ग्रेटर पेट्रोसल नर्व. ग्रेटर पेट्रोसल नर्व विल रिलेट टू व्हाट गैंग्लियन? टेरिगोपैलेटाइन गैंग्लियन. गैंग्लियन से ग्लैंड तक कैसे जाएंगे? फ्रॉम गैंग्लियन टू ग्लैंड वी हैव फर्स्ट मैक्सिलरी नर्व, then we have this connection which is called as zygomatic nerve or zygomaticotemporal nerve, the one you were asking, and then it goes through a lacrimal nerve to supply the lacrimal gland. So this is what it is, that what I said, pterygopalatine ganglion tak gaye beta. From the pterygopalatine ganglion the fibers will go into which nerve? Maxillary nerve. Maxillary nerve will give a connection which is called as a zygomatic nerve, guys. Zygomatic nerve bolo, zygomaticotemporal bolo, एक ही बात है. This zygomatic nerve will join with what nerve? It will join with the lacrimal nerve, and it's the lacrimal nerve which is supplying what gland? Lacrimal gland. देखो कितनी लंबी सीरीज है गाइस. दिस इज एन इंपॉर्टेंट चेन दैट यू नीड टू अंडरस्टैंड हियर. दिस इज हाउ एग्जैक्टली आपका lacrimal ग्लैंड सप्लाइड होता है. तो यू वन थिंग यू नीड टू अंडरस्टैंड दैट lacrimal ग्लैंड इज सप्लाइड बाय फेशियल नर्व ओनली. सो ब्रांच ऑफ द फेशियल नर्व कमिंग आउट इज कॉल्ड एज ग्रेटर पेट्रोसल नर्व. ग्रेटर पेट्रोसल नर्व ने रिले किया, इट रिलेड इनटू व्हिच गैंग्लियन? टेरिगोपैलेटाइन गैंग्लियन. फ्रॉम टेरिगोपैलेटाइन गैंग्लियन फाइबर्स जाएंगे मैक्सिलरी के अंदर. फ्रॉम मैक्सिलरी दे गो इनटू zygomatic जुड़ जाएगा जाके इससे lacrimal से, and lacrimal विल सप्लाई द lacrimal gland. So it's a long pathway. बहुत सारी nerves involved है इसमें which are basically going to supply the lacrimal gland. But yes, it is true that lacrimal gland is supplied by what nerve? Facial nerve. If you have a facial nerve injury here, अगर आपकी facial nerve यहाँ पर injured हो गया तो lacrimal gland गया. So that is one thing, guys. This is one thing about the facial nerve. Now more, let's talk about more here. Now when the facial nerve is running behind the middle ear, जब पीछे की तरफ run कर रहा है, when the facial nerve is running behind middle ear cavity, it supplies one muscle in the middle ear, and that muscle is stapedius. I hope you know there are two muscles in the middle ear cavity. One is stapedius and one is tensor tympani. Tensor tympani is already supplied by the mandibular nerve. देख चुके हम already है. Tensor tympani is supplied by mandibular nerve, and this is the stapedius, the nerve to stapedius. Stapedius को supply कर रहा है. Then there is another branch of facial nerve which will be running through the middle ear and coming out. So there is a branch of facial nerve जो middle ear के through run कर रहा है and coming out, and this branch of the facial nerve is called as the cauda tympani. That's the cauda tympani nerve. Now cauda tympani is an important nerve, but to understand more detail of the cauda tympani nerve, see what we require here is, guys, cauda tympani nerve का काम क्या होता है? The main function of cauda tympani nerve is to take the taste sensation from the anterior two-third of tongue. The main job of that nerve is to take the taste sensation from anterior two-third of tongue. और अगर मैं जरा आपको वापस लेके जाऊँ एक बार, just look at this now. Now you already know that there is a nerve already reaching the anterior two-third of tongue. That is what nerve? Lingual nerve. तो ये तो आसान हो गया. When already you have a nerve reaching the anterior two-third of tongue, so cauda tympani अलग से नहीं जाएगा. Cauda tympani nerve will join the lingual nerve only. Cauda tympani nerve will join the lingual nerve, and then with the lingual nerve only it will reach the anterior two-third of tongue. हालांकि दोनों nerve का function अलग-अलग है. Lingual nerve is responsible for carrying what sensation? General sensation. Cauda tympani nerve will carry what sensation? Taste sensation. But दोनों का root एक ही रहेगा. So what I'm saying is this cauda tympani nerve, it will join with the lingual nerve. Look at that. This here is a lingual nerve. We already know lingual nerve is a branch of mandibular nerve. So cauda tympani nerve will join with the lingual nerve, and it is joining the lingual nerve so that cauda tympani nerve can take the taste sensation. This time it's taste. Taste sensation from anterior two-third of tongue. Taste sensation from anterior two-third of tongue, except circumvallate papillae, guys. Except circumvallate papillae. Now that's one job of the cauda tympani nerve. It takes the taste sensation from anterior two-third of tongue, except circumvallate papillae. एक बात को समझना है यहाँ पर, देखो बेटा नर्व एक ही है, there is only one nerve coming here and that nerve is a lingual nerve. So basically lingual nerve will carry both kind of sensation. This lingual nerve will take the general sensation also and this lingual nerve will carry the taste sensation also. But the general sensation in the lingual nerve will go like this, and will continue in the lingual nerve के साथ ही चला जाएगा. So general sensation will go into lingual nerve only. Taste sensation will come like this here through the lingual nerve and then the taste sensation will pass to which nerve? Chorda tympani. So that's the difference है. So lingual nerve will collect both the sensation from the tongue here and then both the sensation will bifurcate here. General sensation will go into lingual nerve and taste sensation will go into the chorda tympani. बाद में separate हो जाएंगी. I hope you also remember that lingual nerve is also connected to what ganglion? Submandibular ganglion, guys. Lingual nerve is also connected to the submandibular ganglion. And what you'll see that from the submandibular ganglion, some small post-ganglionic fibers will come out and they will supply the submandibular as well as sublingual gland. बेटा ये काम भी किसका है? Chorda tympani का ही है. Now, प्लीज अंडरस्टैंड दिस थिंग वेरी वेरी केयरफुली बिकॉज इसके ऊपर बहुत सारे क्लिनिकल क्वेश्चंस डिपेंड करते हैं. कॉर्डा टिम्पनी नर्व ने बेसिकली लिंगुअल का यूज किया है. कॉर्डा टिम्पनी नर्व हैज यूज्ड द लिंगुअल नर्व फॉर टू थिंग्स. वन, कॉर्डा टिम्पनी नर्व विल टेक द टेस्ट सेंसेशन फ्रॉम एंटीरियर 2/3 ऑफ टंग एक्सेप्ट circumvallate papillae. And two, it is also going to supply what gland? Submandibular and sublingual gland. Both these functions are the functions of chorda tympani nerve, that is facial nerve, but it is done with the help of which nerve? Lingual nerve. Lingual nerve उसको रास्ता दिखाएगा, but actually the function is of the chorda tympani. It is actually the function of chorda tympani. So taste from anterior 2/3 of tongue except circumvallate papillae, and then we have submandibular and sublingual gland. They both are supplied by the chorda tympani branch with the help of lingual nerve. तो guys, this is what the facial nerve is doing inside. ये facial nerve का अंदर का काम है. Facial nerve, as you saw, by the greater petrosal nerve, it is supplying the lacrimal gland. It supplies the stapedius muscle, and with the help of chorda tympani nerve, facial nerve दो काम कर रहा है. One is taking the taste, and one is supplying the submandibular and sublingual gland. Now, after doing all this, ये सब करने के बाद, now the facial nerve will come out of the medullary cavity. Now, facial nerve will come out of the stylomastoid foramen, and this is a very well-known thing about facial nerve that it goes in the parotid gland. So let us say this is a parotid gland, guys. This is a parotid gland. So the facial nerve basically enters the parotid gland, and then you will see that inside the parotid gland only the facial nerve divides into the 5 terminal motor branches. Facial nerve gives off the 5 terminal motor branches. One of the terminal motor branch here is called as a temporal branch. A zygomatic branch. Buccal branch. We have a marginal mandibular branch. And finally, we have a cervical branch. 5 branches. Facial nerve goes inside the parotid gland, और जैसे facial nerve parotid gland के अंदर जाएगा, it comes out as 5 branches. We all know about those 5 branches. हमने अपने first year में पढ़ी है. The pes anserinus, the 5 branches here. The temporal branch, my thumb is the temporal branch here. Then I have a zygomatic branch, my index finger zygomatic branch. Then there is a buccal branch. Then there is a marginal mandibular branch, and then finally we have a cervical branch जो neck में जा रही है to supply the platysma muscle. And these are all motor nerves. They are supplying the muscles. They are all supplying the muscles of facial expression. आपको नाम याद रखने की जरूरत नहीं है अलग-अलग से that what muscles, but they are all supplying the muscles of facial expression. Temporal, zygomatic, buccal, marginal mandibular, and cervical branches. They are supplying the. इसमें से clinical question क्या बेटा? Let's say out of these 5 branches, it's the marginal mandibular branch which can get injured in the submandibular gland surgeries. When you give the incision for the submandibular gland, जब भी आप कोई submandibular gland की surgery करोगे, and the moment you put the incision there, this nerve can get injured here. So that's the question here, that this nerve is most commonly injured. This nerve is most commonly injured in the submandibular gland surgeries. In the submandibular gland surgeries, the most commonly injured nerve is a marginal mandibular branch. वो nerve यहाँ पे रन कर रही है, तो जैसे यहाँ पे incision लगाएंगे, the nerve can get injured in that case here. So this is about the. Now the facial nerve also gives off a branch from the stylomastoid foramen going backwards. Although ज़्यादा important branch नहीं है, I am not going to tell you little more detail about this branch here. Just दो muscle का नाम याद रखना है यहाँ पे. This nerve is mainly supplying the two muscle. One of the muscle is the posterior belly of digastric. Anterior belly of digastric is already supplied by the inferior alveolar nerve. अब वापस देखने जाके inferior alveolar nerve was supplying the anterior belly of digastric. This is supplying the posterior belly of digastric and also the stylohyoid. और ये दो नाम इसलिए important है because both these muscles are not the muscle of facial expression. देखो यार, muscles of facial expression supplied by facial nerve, it's a very common fact. Facial nerve will supply the muscle of facial expression. It's a very well known fact here. The question is, which muscles are not the muscle of facial expression and still supplied by facial nerve? And that's where that is a question here. आपसे examiner ऐसा पूछना चाहेगा, बताओ ऐसी कौन सी muscle है which are not the muscle of facial expression but still supplied by facial nerve, and that is a posterior belly of digastric and the stylohyoid. Posterior belly of digastric and stylohyoid. So guys, this is the detail of the facial nerve which I want to give it to you. So as you can see that facial nerve is wind. ये इस part को याद रखेंगे. मैं आपको अभी break दूंगा actually because after the break we will discuss the injuries of the facial nerve. But बेटा injury discuss करने से पहले ये पूरा anatomy दिमाग में रहना चाहिए. That facial nerve with the help of greater petrosal nerve is supplying the lacrimal gland. It is supplying the stapedius muscle in the middle ear. With the help of chorda tympani, it is carrying the taste as well as supplying the submandibular gland. And then the facial nerve is coming out and going into the parotid gland and supplying all the muscle of facial expression. जितनी भी facial expression की muscles है, they're all supplied by the facial nerve broadly, right? So that is about the facial nerve in here.